If you have a significant amount of excess skin on your chest and you're having gynecomastia surgery, we probably need to perform the skin excision technique. So in this case, or in your case, if you have a lot of extra skin, the only way to get rid of that extra skin and tighten up the skin on your chest and improve the overall contour is by leaving a scar across basically each chest. It's a big long scar, but that is the seam that I need to remove all of that extra skin. And in the end, those scars are gonna look a lot better than the loose, saggy skin. So you're gonna trade all that loose, saggy, redundant skin for scars with improved contour. So how it works is all that extra skin is removed, the underlying breast tissue and glandular tissue is removed. I still perform a little bit of liposuction most of the time to further improve the contour of your chest. Then we sew everything up so you're left with a scar on each chest that's a little bit oblique in that direction. And the last thing I do is take your nipples and put them back on your chest in an attractive location. So where normal nipples would be on a man is where I will graft the nipples back onto your chest. You may read about lots of different techniques where we can reduce and remove the excess skin of a man's chest without removing the nipples from the chest. And I will tell you that in order to do this, we need to keep the nipple alive by leaving it attached to the underlying breast tissue. If I leave your nipples attached to the underlying breast tissue, I can't remove that unwanted tissue and I can't give you the best contour. So it is worth having all that glandular breast tissue removed and allowing me to graft your nipples back on to the best location. The only downside to nipple grafting is that you may lose some pigment of your grafted nipples. The good news is that the same person who tattoos the nipple areolar complex on my breast reconstruction patients can tattoo your nipple areolar pigment back. So I do strongly believe that saving breast tissue to maintain perfusion to your nipples in a man is not worth it, because men want flat, contoured, masculine chests. And if I have to leave breast tissue behind to keep your nipple alive, I can't do that for you. So I would rather risk losing pigment in your grafted nipple, which we can fix with tattooing. I think that is a better trade-off in the end. So that is a description of the skin excision nipple grafting technique. It is reserved for people with lots of excess skin that needs to be removed. And once that skin is removed, it leaves a scar across the chest. To learn about a different technique where I don't have to put any scars on the chest, check out my other video about the no scar on the chest gynecomastia treatment. That treatment option is only appropriate for people with little to no excess skin on their chest. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.